Hey everybody, thank you for joining today. My name is Luke Ferrari. We're going to be talking about autoimmune and immune modulation. This is actually one of my favorite presentations. Quick disclaimer, as usual, I am here representing myself and Kaizen Innovations to review clinical data, share my personal experience. I'm not endorsing or promoting any specific company or brand outside of that context. This content is intended to inform, kind of stimulate ideas for research, not to market, not to encourage any use of unapproved products. I want to be really clear that this presentation is for educational purposes only, intended for researchers doing research. So I'm not providing medical advice. This is not advice on diagnosis or treatment recommendations. This information is not intended for marketing, promotional, or legal advice. Almost all these products that we're going to talk about are not FDA approved, and they are designed for research use only. That's how they're labeled. I am not liable in how this information is interpreted or applied outside of an educational context. My goal is to simply share general knowledge, emerging research, not to direct clinical care. I encourage everyone to view this content through the lens of individual research, judgment, and regulatory guidelines. I am a scientist, but that is because I studied political science, which means don't take my word for anything. Um, this uh, this this is a something everyone needs to do a lot of research on. Okay, so I love this presentation. We're going to be talking about autoimmune and immune modulation. So I'm really excited about today's presentation. Obviously, I think autoimmune disease is such a huge topic. I'm sure almost everyone on this call is knows someone who is affected by autoimmune conditions. Autoimmunity touches nearly every family and is often presented in unexpected ways. It can be everything from very subtle fatigue to debilitating pain, changes in skin, digestive issues, even mood changes. In fact, 1 in 10 people worldwide suffer from autoimmune issue. In the US, the number is 23 million, and that number continues to rise. Because these disease states overlap through so many body systems, I think raising awareness and understanding is really crucial to improving research and bringing health back into the conversation. So for each of these chemicals we're going to be talking about today, we're going to give a brief history. We're going to talk about mechanism of action, how it works, and context of where it's being studied, where it's explored. Reference slides will be provided. Actually, if those reference slides can be added to the chat now, that would be helpful. Also, an important detail is I'm going to be adding how you can get in touch with me directly, including my kaizeninnovations.net, where you can keep up with all of these webinars on an ongoing basis, as well as my direct email and my YouTube page, which is now starting to actually host videos. I know I'm a few months late. I appreciate everyone's patience on that. So let's jump into it. Okay, so thinking about the immune system initially, just kind of thinking really broadly, right? So there are really two main branches of the immune system. There's innate, which is kind of fast and general, and there's adaptive, which is slower and more specific. Innate uses macrophages, natural killer cells, NK cells, as well as dendritic cells as first responders. So adaptive really relies on T cells, B cells to mainly target pathogens and build a immune memory. So these systems are interconnected and they really rely on a balance. So immune modulation works best when both the innate is being trained and the adaptive memory are both aligned. Dysregulation is in this is contributes to chronic inflammation and immune dysfunction. So immune imbalance can lead to all kinds of issues, right? Everything from chronic inflammation, overreactive response, tissue damage, autoimmunity includes where the actual immune system turns and attacks on itself. Immune exhaustion would be poor defense, frequent illness. The gut immune axis is really central to this regulation. Issues like leaky gut, poor microbiome disruption, they can always worsen immune dysfunction. So, really restoring that balance is really critical for really all four components. You've got inflammation, autoimmunity, suppression, and gut health. So, key targets when we're thinking about immune modulation, we want to consider regular T cells are regulatory cells crucial for immune tolerance and preventing autoimmunity. Cytokine modulation helps adjust inflammation and shapes immune response. Mucosal immunity in the gut. This is a really important barrier within the gut as well as the lungs for blocking pathogens and managing local immunity. Additionally, there's oxidative stress and mitochondrial health. Mitochondrial health, that's a whole other series and webinar, but mitochondria essentially influences immune cell function, reducing oxidative load, cellular resistance, and systemic inflammation control. Okay, this is one of my favorite chemicals, and that is thymosin alpha 1. Interestingly, thymosin alpha 1 is not FDA approved. However, it is approved in 35 countries throughout the world, and its trade name is Zadaxin, Zadaxin. And so this is one of my favorites because it's one of the first initial peptides I was ever introduced to. And really, it's commonly referred to as an immune conductor or immune recalibrator. So obviously, these are really informal terms, not clinical or regulatory designations. But thymosin alpha is essentially a immune regulation pe peptide. So research indicates it helps educate and balance the immune system rather than overstimulating it as some other products. It is extremely well tolerated. It's been used in multiple clinical applications. Hepatitis B, C, even has been studied for cancer support or excuse me, support of cancer patients. So how does it work? So thymosin alpha 1 supports the maturation and activation of T cells, which play a central role in adaptive immunity. So it also has been shown to enhance dendritic cell activity, aiding in the recognition of pathogens and initiating appropriate immune responses. Research indicates it may increase interferon alpha production and natural killer NK cell activity. So, this contributes to both antiviral defense and innate immunity. Research suggests that it helps restore immune balance in cases of chronic inflammation, immune suppression, and dysregulation. So the following dosing protocols, so I figured out that I can provide dosing protocols on these webinars as long as they are coming from a well-regarded source. And so all praise to Dr. James Laval and his book, The Peptide Handbook, A Professional's Guide to Peptide Therapeutics. I will provide a link where you can buy this on Amazon for $35. That he at the time he was the president of the International Peptide Society. So standard dosing protocol is 1.5 milligrams subcutaneously every 2 days for 6 to 12 months. So that's kind of a more extreme long-term dosing for really complicated cases, including Hep B, Hep C, and even HIV. Zadaxin, the drug, is usually combined with conventional therapies, including immune-related conditions such as virals, even oncology support. So, long-term use seems to be very well tolerated, and it's known for its excellent safety profile. So here are some of the clinical research, as I mentioned, published studies that are going to be provided for you in a PDF in the Zoom chat, include studies on hepatitis B, hepatitis C, showing potential support for antiviral immune responses. Additionally, very specific cancers, particularly in conjunction with standard therapies. So it's also been studied in sepsis, and research indicates there's a potential to recalibrate the immune system. I use it kind of randomly, to be honest with you. I just use it and it seems to help me stay healthy. I definitely use it more when I feel like the potential of sickness is coming on or when I'm really run down. Okay, next is thymosin beta or TB500. So thymosin beta is the term used when it's in its natural state, directly from the thymus, and TB500 is the synthetic fragment. So TB500 essentially is what you'll see if you're actually using a research chemical. So this is one of my favorites as well. It's a naturally occurring peptide already found in human tissue, especially in platelets and in immune cells. It's not FDA approved. TB500 has been investigated in preclinical and early clinical phase research to support tissue regeneration and healing. Its clinical interest is really distinct from thymosin alpha, which focuses on immune modulation, whereas TB500 is more associated with tissue pathways. The use of TB500 remains strictly investigational with international interest, but there are no approved therapeutic indications. So TB500 really acts as a cell migration mediator, directing regenerative cells to the site of injury, promotes angiogenesis, supporting the formation of new blood vessels, improve nutrient delivery to tissue healing. It enhances collagen deposition, contributing to structural integrity and repair during the healing process. So its mechanism of action really aligns to support tissue remodeling, wound closure, and vascularization, all key to recovery. Again, all praise Dr. James Laval, Peptide Handbook. TB500 can be used for a variety of research, and the general range is typically anywhere from 300 micrograms to 1 gram daily. Most patients are using this subcutaneous route. With this one, cycling is actually important. Typically, research indicates you want to do 3 months on, 6 weeks off, or shorter than 6 week cycles. Continuous use longer than 3 months without a break should be avoided. It's not something you just want to be on constantly. Um, References will be provided, but essentially it's been studied for as an investigational for tissue regeneration across multiple organ systems, wound healing, diabetic ulcers, surgical injuries, cardiac repair, post-myocardial infarction, neuroprotection, and CNS trauma and stroke, corneal healing and ocular surface injuries, spinal cord injury and nerve regeneration, liver injury and ischemia reperfusion damage, chronic inflammation and immune modulation pathways. So each of these references are going to be peer reviewed, PubMed, Nature, etc. Curcumin. Curcumin is really interesting. And what do most people think about when they hear curcumin? Personally, for a long time, I just thought about really delicious curries and delicious food from the Far East. And so also you think about turmeric, right? Supplements you get at the grocery store. But surprisingly, it goes a lot deeper than that. Curcumin is actually being studied as an IV. Yeah, some people are doing it. So curcumin is active compound in turmeric. It's really been long used in Ayurvedic medicine and studied for its anti-inflammatory effects. But oral absorption, obviously, anytime something's oral, you're going to have limited viability and absorption. So there is a lot of research going on to other uses, including IV, that we're going to get into. So mechanism of action, how does it work? So curcumin essentially works by downregulating or dialing down inflammation at its source, specifically blocking the NF-κB pathway, which is essentially the master switch for inflammatory processes. It's a really powerful antioxidant, helps clean up damaging molecules and really fights the wear and tear on your cells. What makes curcumin really interesting is how it boosts your own glutathione production. Obviously, glutathione is the body's most powerful antioxidant. And so essentially by turning on the enzymes that build glutathione, it's able to support that glutathione production. So it ramps up enzymes like glutathione S transferase and glutathione paradoxase, which use glutathione to detoxify the body from stress and toxins. It's just disappeared. Here it is. Along with curcumin, can also help balance. Research indicates it can potentially help balance the immune by influencing some of the most important messenger molecules. All these benefits make curcumin a favorite in supporting immunity and lowering inflammation. And so I'm not going to get into dosing on this presentation. I haven't really seen enough information on that, but what you're looking at here, this is Dr. Anderson. So for clinically validated research and dosing information, please refer to Dr. Paul Anderson. He's a leading naturopath, integrative medicine, and we're going to provide a link to his monograph and resources will be made available in the chat. So essentially, Dr. Anderson is recognized educator, clinician, and researcher in integrative naturopathic medicine with a particularly focus on infectious and chronic and oncological illnesses. With over 3 decades of clinical experience, he's the head of the interventional arm of the NIH-funded clinical trial using IV integrative therapies in cancer patients. He's a frequent speaker. He's a great guy. I strongly recommend everybody actually find his websites, which are listed here, consultdranderson.com, as well as consultdra.com. He also has a YouTube page, extremely beneficial. Dr. Anderson has a great way to break down science and literature, his clinical experience. I guarantee everybody on this webinar would benefit from subscribing to his YouTube. He talks about all kinds of IV interventions, talks about methylene blue, talks about high dose vitamin C, chelation. He's a real expert and a really great guy. He also has regular trade shows that he focuses on integrative medicine. Any integrative practitioners would it would be a huge benefit for anybody to follow Dr. Paul Anderson. These curcumin references will be put in the chat. Thymolin. Okay, so thymolin is really quite interesting as well. So thymolin is a peptide hormone originating from the thymus gland. And so interestingly, it's actually bound to zinc for its biological activity, meaning you have to have enough zinc in your body for it to really do its job. That's why zinc is such an important uh, component of health. I take zinc daily. The thymus is central immune organ responsible for training T cells to recognize and attack foreign invaders while protecting normal tissue. Process vital for lifelong immune defense. So, thymolin's primary clinical relevance is immune support. So, it essentially boosts lymphocyte population, includes T cells, NK cells, and really drives immune function. So, age-associated decline with thymolin may contribute to immune weakening and risk for chronic illness and infection resilience. Thymolin also regulates inflammation and communicates directly with the brain via the endocrine system, uh, to have a very broad impact beyond traditional immune modulation mechanisms. So Thymolin is only active when bound to zinc. So this complex really interacts with the immune via the neuroendocrine targets. Mechanicalistically, thymolin promotes maturation and differentiation of T cells and enhances NK cells. So thymolin limits immune overreaction by suppressing different pathways and reducing pro-inflammatory mediators. So beyond immune effects, thymolin regulates neuroendocrine function, interacting with the hypothalamic pituitary adrenal HPA axis. That basically modulates the pituitary hormone release. So totally experimental research shows that analgesic and neuroprotective actions, partly via direct effects of the brain via that neuroendocrine system, central inflammatory signaling. So again, thank you, Dr. James Laval. This is coming straight from Peptide Handbook. Standard protocol, 1 milligram of thymolin subcutaneously for 2 weeks, then 1 milligram 3 times weekly for 4 months. In acute scenarios, it can go up to 5 milligrams daily sub-Q. So thymolin is really interesting because it has a very short half-life, 30 to 60 minutes, but immunomodulatory effects persist much longer. So clinical studies uh, have a very high safety profile, minimal adverse effects. Again, effectiveness is zinc dependent. Okay, so GI modulator. So this is a little bit different. This is a unique product, and it's actually oral in its administration. It kind of looks like one of those small ginger shot glasses you would purchase at the grocery store. And so this is a oral drink, and it's a combination of everything that you see on your screen. So the original thinking behind this was uh, individuals suffering from GLP-1 related gut distress. But I think that its utility is potentially far beyond that. So, formulation allows for absorption for both local and systemic levels, giving more versatility than typical oral supplements. So, it's built to keep ingredients stable essentially through the digestion, especially when you're talking about really delicate compounds and peptides. So results vary anecdotally, totally anecdotally. Individuals I've spoken with directly tell me that it's actually improved their, um, what was it? So obviously GI distress. Personally, I've used it when I've had GI distress and essentially, resolved it extremely quickly. I won't tell you all the gruesome details, but essentially, I just took one or two of these and my gut was totally resolved. And then, totally anecdotally, it's also been shown to improve one individual that I know that had a great improvement regarding their allergies. So it includes BPC-157, KPV, thymolin, thymosin alpha, quercetin, resveratrol, berberine. It does not taste very good. Tastes terrible, actually. So we're going to talk about each of those products that's involved. So BPC-157, if you've been on any of my webinars, you're probably tired of hearing about this, but focus today will be about how it improves the gut barrier. So it is a naturally occurring peptide. It was originally discovered in human gastric juices. Research indicates it supports angiogenesis, epithelial regeneration, barrier integrity, particularly in the GI. Frequently studied in the context of intestinal permeability or leaky gut, the gut-brain inflammatory signaling. Research suggests that it may help regulate cytokine activity and reduce inflammatory overflow. So its primary value potentially lies in supporting the gut lining and maintaining immune balance and mucosal surfaces. KPV, another popular chemical. KP is a short peptide. It's well documented for its anti-inflammatory properties. It works by binding melanocortin receptors, helping reduce inflammation and at the molecular level. So its action is targeted and localized, especially when it comes to hyperactive tissues in the gut and the skin. Investigational interest includes things like colitis, eczema, even autoimmune flare-ups. Researchers have explored this tool for balancing immune overactivation and without broad suppression. Quercetin. Quercetin is not a peptide. It is a natural flavonoid. It's found in foods like onions, apples, even berries. It's been studied for decades due to its powerful anti-inflammatory and antioxidant properties. Historically, it's used for general wellness and immune support. Mechanism of action, basically, essentially a very powerful antioxidant, neutralizing free radicals, reducing oxidative stress. When it comes to anti-inflammatory, it shows significant benefits, actually lowering cytokines. Immune modulation, potentially going to stabilize mast cells, and works to potentially stabilize the immune system. Berberine. I think berberine is probably responsible for this uh, product GI mod tasting so terrible, but it is what it is. So berberine is a plant alkaloid. It's used for over 2,500 years in Chinese and Ayurvedic medicine, traditionally used to treat infection, especially in the gut, later found to be also useful for metabolic conditions. So it activates the AMPK, activated protein kinase. So potentially improving insulin sensitivity, increase glucose uptake, promotes fatty acid oxidation, modulates gut microbiome. Uh, Also, it alters the microbiome composition. So it's got huge potential for anti-inflammatory signaling, reducing pro-inflammatory cytokines, potentially even lowering cholesterol, and potentially increasing LDL receptor expression. Resveratrol. So, resveratrol is a polyphenol naturally found in red grapes. I think that was the big kick all the wine lovers jumped on for so long in the late 90s. It's widely studied for its role in longevity, metabolic health, and inflammation. Mechanism of action essentially activates a key protein linked to aging and metabolic regulation. Also, it's known to support the gut barrier through strengthening tight junctions between the interstitial cells. So it may help maintain gut lining integrity and reduce permeability. Additionally, research indicates there's a ton of benefits to help promote growth in the microbiome of beneficial bacteria, essentially supports overall gut health and immune function. So you could throw 20 ingredients into a blender and hope they work. But rather than doing that, all these products have been added for their intentional synergy. And so GI Mod, one of my favorite products to have handy just in case there's a gut issue. So this is not just a gut product. I would frame it as, GI Modulator is really built on multiple anti-inflammatory sources, starting with the gut, but really reverberates systemically. So I would use it for myself if I had any IBS or IBD. Using this, I also use it anytime I'm getting sick to help stave off any like viral GI symptoms. So it's kind of interesting in that the delivery system. So it's all these chemicals are bound in a non-glycemic sugar inclusion complex. Essentially means that each molecule is bound up so that it's going to help it get through your gut and potentially even cross the mucosal barrier. So it stops molecules from destructively interacting with one another, which is very common when it comes to combination products. And this basically just covers everything we've talked about, potential benefits, and even more. So that's it for today's presentation. I do hope you found it beneficial. Again, this is not intended to be all-encompassing, really just to kind of stimulate your thought processes around any research that you're doing.